Okay.
A very good evening to one and all. I am Arpita, the moderator for today's session from the IGCP group. The topic that we are going to discuss today is screening and early detection of breast cancer. It is a session as we are celebrating the Breast Cancer Awareness Month. So, in our series dedicated to the screening and early detection of breast cancer, part of our Breast Cancer Awareness Month initiative, early detection is vital for improving survival rates and treatment outcomes. This webinar will cover the latest guidelines and recommendations for breast cancer screening, including mammography, clinical breast exams, and emerging technologies. Our expert speaker, who is with us today, will discuss risk factors, screening interventions, and the importance of individualized screening plans, particularly for high risk populations. It's an honor for me to welcome ma'am to our platform and to introduce her to everyone. So we have with us Dr. Geeta Kudayaprat ma'am. She is a senior consultant, breast surgical oncology and oncoplastic surgery lead at Apollo Women's Cancer Center, which is the Indraprastha Apollo Hospital at Delhi. So with this very brief introduction of ma'am, now I would request her to please start with the presentation. Once she is done with her presentation, we'll take the questions from our audiences. Over to you, ma'am.
Thank you very much, Arpita. So my mandate today is to try and bring to you what is the current situation with breast cancer and what is it that we're trying to do to create breast cancer amongst not just doctors but also the general public, because I think awareness is the only method by which we are going to get anywhere close to beating this disease. So, so it is very important to understand if it is possible to detect breast cancer early, because we do know it is not possible to, kind of prevent it, but we can of course detect it early. So there are some cancers which can be detected before any symptoms appear at all, but breast cancer is not one of them. But I will tell you as we go along as to what is it that we can do to detect breast cancer early. And why do we keep emphasizing on why do we want to detect breast cancer early? Is because early diagnosis is actually the key to surviving breast cancer. So if you were to pick it up really, really early, and when I say really, really early, I'll elaborate upon that as well as we go along. About 97 to 98% of women who are diagnosed with very early breast cancer survive beyond 5 years and more. And with the current kind of treatment that we have, it is possible to beat breast cancer in a large number of women who are detected with early breast cancer. So when we talk breast cancer, the first question that is asked is how does it happen and why does it happen? So there are no easy answers to it. So we do know there are risk factors to it. And when we say risk factors, we talk about those factors which we cannot modify. And there are other risk factors that can be modified. And I will just elaborate upon each of these. So if you talk about non modifiable risk factors, the most important risk factor is the fact that you're a woman. Being a woman is the biggest risk factor. And if you say men, it is 100 times more common in women than in men. And that also means to say that men are not excluded from breast cancer. So 1% of all breast cancers do happen in men. And when you talk of age, with growing age, you will find even today 70 to 80% of breast cancers happen in women who are over the age of 50. And in our country, what we are seeing is an alarming trend, and that is that about 20%, 15 to 20% of women are under the age of 40 when they're diagnosed with breast cancer. So the other thing that which you cannot modify, and that is your family history. But we should not pay too much of importance to family history alone, because in about 10 to 15% of patients you will find a family history. In the rest you do not. But in those in whom you do have a significant family history, one needs to look at it differently. And then you talk about genetic mutations, meaning in your genes that there could be an aberration which could lead to breast cancer. But again, this also contributes to not more than 5 to 10% of breast cancers. But those women who do carry this mutation, there is a higher, very high incidence of developing breast cancer during their lifetime. If one has had a personal history of breast cancer, suppose you've had breast cancer on the right side, then there is a 3 to 4 fold increased risk of developing breast cancer on the opposite side. In fact, we would say that there is a 1% per year risk of developing breast cancer on the opposite side. And then you would see that there are women who have these lumps removed but they are not tested by a pathologist. So those lumps could actually be hiding a certain truth behind what happens later on. So whenever you were to get a lump removed, please do ensure that it is tested by a pathologist. That is very, very important. And then there are certain other non modifiable risk factors like your menstrual history. So, those women who start their periods early and finish late, they get exposed to hormones for that much longer. And they also tend to have bigger risk of developing breast cancer. So if you see these days, you will find that kids the age of 9, 10, 11, they start periods very, very early, which was not the case when we were kids, when the usual age at which periods would start would be around 14, 15, 16. So there is something that we are not doing right, which is getting our kids to have periods very early. And then there are certain races. So the most well documented race where you see a lot of cancers is the Ashkenazi Jews, because there is a lot of consanguinity in this particular race. So when you have consanguinity, when there is a lot of inter relationship marriages, what happens is that the genetic pool kind of narrows down, and that can again give rise to a lot of cancers. And it happens in our country also. If you go down south, you will find uncles getting married to their nieces or first cousins getting married to each other. And this again can give rise to a lot of aberrations in the genetic code, which can give rise to cancers again. So now let me take you through those risk factors which you can modify. One of them is your reproductive history. I know in these times when everybody is trying to make a mark for themselves and are caught in a certain race, a lot of times having children takes a backstage, and women tend to have children much later. But it is always a good idea to try and have your children early, because that definitely does reduce your risk. Oral contraceptive use, it's not a very well documented risk, but if you were to have it for a very long duration, say over 10 years, that does seem to have a certain increased risk. But those women who have attained menopause and tend to be on hormone replacement treatment, they do have a increased risk of breast cancer. So, and then talk about alcohol, and the current WHO recommendation is that one should not be consuming any alcohol at all. But if you must, I would say that you should not have, and one must really look out for your weight, because obesity, an increased amount of fat, is known to be a breeding ground in a way for all kind of cancers, because a lot of fat tends to keep you in a constant state of inflammation, and that is known to give rise to several cancers. Physical activity, again, I cannot overemphasize this, because physical activity is known to reduce the risk of several cancers. And if one does have a cancer and continues to perform physical activity, it has been seen that the outcomes are better in those women who continue to exercise even post the diagnosis of cancer. So, various studies have shown that there is a almost 40% decreased risk of breast cancer in those women who exercise regularly. And when I say exercise regularly, I'm talking about moderate intensity exercise for half an hour every day. So that is about 3.5 hours a week, which is not really asking for much, really. So when I say importance, the importance of early detection is that obviously, if you were to detect it very, very early, the outcomes are so much better. And as you go down to a stage 4, you realize that the ability to kind of survive the cancer also reduces significantly. So, how does one detect breast cancer early? So, there is a three pronged approach. So, one of them is a screening mammogram. The second is a clinical breast examination done by a health personnel. And the third method is a breast self examination. So, let me just take you over the American Cancer Society. So, the American Cancer Society just recently revised its mammogram indications. It was 50 years, now it has come back to 45 years. So they say breast a mammogram to be done every year for women over the age of 45, clinical breast examination every 3 years for women between 20 to 39, and yearly for women over the age of 40. And as far as breast self examination is concerned, it should be done every month. Let me just elaborate on each of these. So when I say a mammogram, so in our country, mammogram is not accessible to all, and it is basically relegated to an opportunistic screening. So those who can find a decent place where a mammogram can be done, they tend to be going there and doing a mammogram there. So it is an X-ray of the breast. So patient people do complain of discomfort with a mammogram, but it is a very good investigation to pick up a breast cancer at its earliest in the form of specks of calcium, which can actually be stage zero, and that is as good as not having the disease at all. And this is a beautiful study that has been conducted by Tata Memorial Hospital. This is a 20-year study, and there they showed that in those women who were examined by health workers every year, it did lead to downstaging of the disease. And in those women who were over the age of 50, it reduced the risk of dying of breast cancer by 30%, which is just amazing. So this is about clinical breast examination. Although the benefit was not seen in those younger than 50, but over the age of 50, it definitely had a huge impact. So now let me talk about breast self-examination. So breast self-examination is, I think, a weapon which is in your hand, and one must do it every month, consistently and diligently, and do it right. And when should you do it? If you're having your periods, do it 2 or 3 days after your period stops. And if you do not have your periods, you're menopausal, you can pick up a day of the month which coincides with your birthday, or it could be the first of every month, and that is good enough. So, how should you be doing a breast self examination? So, don't use the tip of your fingers because the tips are very, very, what you call, sensitive. It is best done with the pads of your fingers, and you have to make sure that the entire breast is covered, and you are basically trying to look for lumps or any changes under the skin. So what you need to do is you do it in standing position. You can do it in the washroom, in the bathroom when you're there for a bath. That's the best time to do it, because when you apply soap and water, your hand tends to slip over any abnormality in the breast, which can be picked up pretty early. So stand in front of the mirror and try and place your arms by the side, and then also clasp your hands behind the head to look for any unusual discharge that is coming from the nipple. Is there any dimpling on the skin? Has there been a change in the skin, like an orange peel appearance of the skin? Is there a change in the shape of the breast? And all of that is what you're supposed to be looking for when you're standing in front of the mirror. And when you do a breast self examination, you should be doing it both in standing and lying down position. So when you're standing up, you're basically dividing the breast into, say, four parts, and then gently run your hand, rotate your hand, press, rotate, slide, press, rotate, slide, and cover the entire breast. Don't raise your hand, because the moment you raise your hand, you're likely to miss some part of the breast which may be actually harboring an abnormality. So divide it into four, or you can go round and round and round, or you could be doing an up and down, but just ensure that the entire breast and the central portion of the breast, which is the nipple and the areola, is also covered when you're doing a breast self examination. So these are the changes, like I said, you should be looking for. Any lump. And the thing about breast cancer is it is usually a painless lump that makes an appearance. So a painless lump should be seen by a breast surgeon, and it should be investigated and taken to its natural conclusion. which you should not be ignoring it at any age. A recently detected lump should not be ignored at any age. That is what I want to leave you with, the message. So I'll just take you through various myths regarding breast cancer. And just one slide about the risk of breast cancer in transgender. It is not any different. It is actually lesser in the sense that there is not much breast tissue in the trans men and trans women. So the absolute risk of breast cancer is low, but the treatment modalities remain the same for the transgenders as well. So let me just take you through a myth to some myths very quickly. So one thing you must understand, that finding a lump in the breast does not mean that you have cancer. 8 out of 10 times it will be non-cancerous. But the important thing is to establish that it is not cancer. Only women with a family history, like I've told you, 90% of women with breast cancer do not have a family history. So don't think that if you don't have a family history and there is a lump in the breast, you can sit over it. Please don't do that, and do show a breast surgeon at the earliest. Men, like I said, 1% of all breast cancers do happen in men. So don't think that men do not get breast cancer. Fortunately, the incidence is very, very low. Only women in their 40s and 50s get breast cancer. That is also a myth. I've already told you that in our country, we're seeing about 15 to 20% of women getting breast cancer under the age of 40. Antiperspirants, deodorants, black bras, all of this underwire bras causing breast cancer. That's not true. All of these several trials have been done to show that antiperspirants and deodorants really don't cause or increase the risk of breast cancer. Mammograms can cause breast cancer to spread by virtue of the pressure. That is also not true. And biopsies, needle biopsies that are done to establish a diagnosis of breast cancer and to understand what is the type of breast cancer is not true at all. Biopsies do not cause breast cancer to spread. It is actually helping us making a diagnosis and offering you the breast treatment. If you're a high risk for breast cancer, there is very little you can do about it. So I do know that just as everybody else knows that non-modifiable risk factors is not something that we can change, but those things which are part of your lifestyle and are affecting your risk can definitely be minimized. So minimize alcohol consumption. Tobacco is another one of the evils which is part of our society, and this is something that one should make every effort to give up, and we must incorporate regular exercise in every week of our existence. High fat diet can cause breast cancer. There is no direct correlation, but it is understood that if you obviously have a high fat diet and were to increase your weight, that may be a reason for breast cancer. An injury to the breast can cause breast cancer. This is often, quoted by patients who come to the outpatient and say that, I've had this little injury because my grandchild ran into me or whatever. But injury is what brings your attention to your breast for the first time. So you actually discover a lump primarily because of the injury, and it is not the injury that causes breast cancer. And only large breasted women get breast cancer. That is also not true. The size does not matter. You could be big breasted, small breasted, and still one can get breast cancer. And this is the biggest myth that you must get out of your head. And that is, if you get breast cancer, you will probably die. That is not true. In the last 2 decades, a lot of progress has been made in the treatment of breast cancer, and it is brought about a lot of good news to patients with breast cancer, and a lot of patients are beating breast cancer. So I will leave you with these take homes, and that is, early detection is what is the key for better outcomes. And do not forget the three pronged approach to screening, which is mammogram, clinical breast examination, and breast self examination. With earlier diagnosis and improved treatments, many women are beating breast cancer, and that's great news for all of us. And I know you're all multitaskers, multitasking women in your house, but please take care of their health and do ensure that they do get a mammogram done if they're over the age of 45. So, this Diwali, I would say that you should gift the women in your house a mammogram, so that if there is anything that is there in the breast, can be picked up early and treated with very minimal side effects. Thank you very much.
Thank you, ma'am. Thank you so much for your very enlightening presentation that you have shared just now with us. Ma'am, can we take the questions from the audiences now?
Yes, please go ahead.
Okay, ma'am. So let us see what are the questions that has come to us. Ma'am, the first question is how effective is mammography compared to other screening methods like the ultrasound or MRI for early detection?
So, in younger women, women less than the age of 40, a mammogram is not a good investigation because these young women have very dense breasts. So, when I say dense breast, it means that the mammogram will look white. And cancer is also white. So, white against white is something that you will not be able to pick up. So, in women under the age of 40, mammogram is not a good idea to screen. There, you would have to do an ultrasound to pick up abnormalities. So MRI is not to be used in place of a mammogram or an ultrasound. A lot of times, even in women who are age of 45, we would do a mammogram, find dense breast, and then we would ask for an ultrasound to clarify things. So MRI is to be used only as a problem-solving tool, not as a screening modality. It is used as a screening modality in high-risk women. So when I say high-risk women, it is used mostly in those women who have a very strong family history or are carrying a genetic mutation. Only in those patients you would use MRI as a screening modality.
Right, ma'am. Thank you, ma'am. Thank you so much for answering this query. Moving on to the next one. Ma'am, what are the key symptoms or warning signs that women should be vigilant about between regular screenings?
So that's a very good question because especially in younger women. When I say younger women, I'm saying even the ones in their 40s. They tend to get this false sense of security when they do a mammogram, that between two mammograms nothing will happen. But some aggressive cancers can actually come up even between two screening times. So in those patients, like I said, very very important to be breast aware. You must be aware of your breast. Examine yourself every single month in a very very diligent manner and very conscientiously, so that you would be able to pick up abnormalities. And if you were to find anything, you must report to the doctor. Like I said, a painless lump is the most common symptom. And unfortunately, people think that a painless lump is not doing anything to me. They don't come to the doctor. And by the time they come, it has come to such a size when it is kind of advanced.
Right, ma'am. We have another query. Ma'am, how do lifestyle factors such as diet and exercise influence the effectiveness of breast cancer screening and early detection?
So, how does lifestyle affect the screening?
Yes, ma'am. Is there any role of lifestyle and all for screening? Maybe he
So,
wants to
see,
know about
screening is
screening.
one part. So, so screening is one part of it, but the important part is, so you have to take lifestyle and exercise as the other bit. That is basically to improve your chances of not getting breast cancer. And screening has to happen as a usual thing. So but those who do not have a very strong family history or do not have any genetic mutations and all, you are what you would say is a general population risk. So if you have a general population risk, so the US recommendations are very very stringent, but the UK recommendations are slightly more conservative, in the sense that if you don't have a very strong family history, you can do mammograms every 2 to 3 years after the age of 50, unlike the US where they're doing it every year after the age of 45. And in young breast cancers, you can actually miss the cancer can put up an appearance between two screenings. So in our country, I think we have to somewhere tread the middle path. and possibly do it once every 2 years, if not every year. And of course lifestyle and food habits. So I always think, when patients come back and say, I do all the right things, I eat well, I've been exercising, and still I've got cancer. So my answer to that question is, we eat right, but we do not know what is the source of our food. So what has your food got in it? Has it been subjected to a lot of fertilizers, pesticides? Who's regulating it? So a lot of times you may be eating right, but the source of food may not actually be right. So those are the things that one needs to look at. And I think, we need more advocates to put this question to the corridors of power, to figure out how do we get around, regulating the amount of pesticides and fertilizers that go unregulated in our crops.
Right, ma'am. Very correctly pointed. Maybe we are eating the right thing, but the source is not right, and we are not
Yeah,
sure from where the food is coming. Right, ma'am.
exactly.
Ma'am, there is a question from Jenny Jogelkar. Can duct ectasia can cause breast cancer later, even after surgery?
So, see, duct ectasia essentially means that your ducts have become a little wider, as not as compared to usual, when normal ducts are very, very thin. But with breastfeeding, and that these ducts tend to become big, and they tend to store a lot of secretions. Sometimes the secretions come out. So that is duct ectasia. So ducts per se do not, duct ectasia per se does not increase your risk of breast cancer. It's a normal physiological thing that you see a lot of times. It is the terminal duct with the lobule. That is the usual site where breast cancers emerge. But duct ectasia per se does not increase your risk of breast cancer.
Thank you, ma'am. I hope Vinny has got the answer. Ma'am, one last question. That is, what is the role of genetic testing in identifying high risk individuals for breast cancer and how it influences the screening protocols?
Yeah. So, now in the current times, genetics has come to stay, and there is a lot that is happening in the genetic space, and we are picking up a lot of new genetic mutations, which may be giving rise to various cancers. So, a lot of cancers, and it is not just about the mutation; it is also about treatment, because a certain mutation, you could be having an actionable gene mutation, and there are drugs to take care of it. So that is the space that we are in, and as we speak there is so much of research happening in that area, and all this transpired after the entire human genome was kind of sequenced, and people were they were able to identify which genes was working with which organ, which cancer, and all of that. So, when we talk of mutations, the commonest mutations that we are aware of in breast is the BRCA1 and BRCA2. But like I said, since the times that we've been talking about various genes, now we know that it is not just BRCA1 and BRCA2, although they are the commonest, but then there are a lot of other genes which are associated with breast cancer. And the emphasis now is on figuring out how strongly they're associated with breast cancer, whether it is PALB2, CHEK2. So these are some names of genes which are associated with breast cancer, and these can tell us, if you're carrying that gene mutation, what is your risk of developing breast cancer. So if I were to say a BRCA1 mutation, if somebody is carrying a BRCA1 mutation, I would say there is a 70 to 80% chance of developing breast cancer during your lifetime. If it is a BRCA2 mutation, you would say 40 to 60% chance of developing breast cancer, but then you could be having a 60 to 70% chance of developing ovarian cancer with BRCA2. So similarly, the other genes, they have pegged a certain percentage to it. But as we learn more about these genes, obviously, these the other genes could also come center stage and tell us, this actually leads to a lot of breast cancers, and such information can come through. So when somebody is carrying a gene which can poses a very high risk of developing breast cancer, just as you must have all heard about Angelina Jolie, who carries the BRCA1 gene, and that is why she went ahead and got prophylactic surgeries done. She had her breast removed and reconstructed, and then went ahead and got her ovaries removed also, to reduce the risk of developing both breast and ovarian cancer. So these are some of the things that can be done to reduce your risk of breast cancer. But there are patients who may not want to go that way because it's pretty radical trying to get both your breasts and your ovaries out. In that case, one can go for close surveillance. When I say close surveillance, which means obviously how do you screen such patients? So in these patients, you would start surveillance very early, even at the age of 25. You would do mammograms alternating with MRIs. So this is the group where you would want to do MRIs also because there is no other go. So you could be doing mammograms, say at in January, if I were to do a mammogram, in July I would do an MRI, and then again in December I would, again the next January I'll be doing a mammogram, and then so you're alternating. So every 6 months some form of imaging has to happen in these patients if you want to closely watch them, because they do not want to consider the other option of having prophylactic surgeries. When I say prophylactic surgeries, that means surgeries done before the disease has come up.
Right, ma'am. Ma'am, with this, we come to an end of the session. I would like to extend my sincere gratitude for the information that you have shared with us, for engaging everyone, and for your very enlightening presentation. And ma'am, your insights and expertise has provided us with a very clear understanding of this topic, breast cancer, and will undoubtedly have a lasting impact on the approach. So
Thank you so much.
thank you, ma'am. Thank you so much. The ability with which you have it's such a complex topic, but you have made it so simple in your own way. So
Thank
thank
you.
you so much. Thank you.
Thank
Thank
you
you
for
so
the
much, ma'am.
opportunity, and I loved being on the show. Thank you so much.
Thank you. Thank you so much, ma'am. Thanks to all the audiences for putting up your questions. So with this, we are coming to an end. Thank you so much, ma'am, for all the efforts and the time. Thank you, ma'am, once again.
Thank you. Thank you so much.